Okay, now we'll start. All right, so CSAP, it stands for Comprehensive Stool Analysis and Parasitology. There's a lot on social media right now about like parasites and parasite cleanses, and I don't really know what to believe and what not to believe, and you guys probably feel the same. But we do test all of that in this test. This is something that I get and you typically order on every patient that I'm working with in a functional medicine capacity because there is so much literature on the gut being the root of so many things: chronic disease, obesity, cancer, autoimmune conditions, thyroid issues. We're learning so much about the gut microbiome. It's becoming even more popular in the conventional medicine standpoint. And, having moved from conventional medicine to more functional medicine, it really kind of blows my mind that we aren't taught as much of this in the conventional setting, but I do think that that's changing, and I hope that it does because it really is significant. I don't know how many of you were able to watch the Netflix documentary, Hack Your Health, Secrets of Your Gut. I think they do a pretty good job of painting the picture of our guts being, they describe it as like a forest. I usually with my patients will describe it as a garden. And so we're looking at what's growing, what do we want to grow? Are there weeds? Are there other things there that are, affecting the whole ecosystem? And they give a lot of good visuals. They talk some about stool testing, and I guess my opinion on that is it always helps me as a practitioner to see what's going on in these patients' gut microbiome, especially because I do deal mostly with like weight loss and some complex clinical puzzles. So it gives me a lot of information. And I also feel like when patients can see it on paper, it's easier to commit to making change. Like when you can see, okay, this is what it looks like. And I can tell you from my perspective with getting my tests back, I had never been compliant with an elimination diet because I'm like, well, I kind of do want milk or dairy, or surely it's not that big of a deal. And then when I see this on paper, I've like actually committed to it and have a plan going forward. So I did the testing on myself because I do feel like it's so important and just everything that we're learning about the gut. Some family history, specifically of like mental health disorders. And there's a lot of research coming out about the gut brain connection. And, we use a lot of terms like if you do something brave, you're gutsy. If you're nervous, you have butterflies in your stomach. So there's all these references that we've kind of said for years that associate the gut and the brain, and it is significant. Um, so from a symptom perspective for me, I would say that I feel pretty good. I've always considered myself a pretty big eater. Like I'm not a very large person. I'm a more petite, but I and my dad would always kind of joke, like I can eat anyone under the table. I mean, I can put some food away. And part of me is like, it was a joke for a while. Like, do you have a tapeworm? Seriously? And so you add in 3 kids and the foods that they're eating and stress and being in the car all the time. And I felt like I really didn't have a lot of control over appetite regulation, like, craving sweets, wanting something really salty, just kind of wanting junk, definitely more than I had in the past. I had 3 C-section deliveries, and they give you oral antibiotics and IV antibiotics, like with that. Um, I was born via cesarean section, which there's a lot of literature about when the baby does not come through the birth canal. Like you are born with really no microbiome, and you really rely on the mother and the maternal birth canal to like inoculate a lot of that bacteria. And C-section deliveries are on the rise. I had 3 of them. I'm still very like, get the baby here safely, but that definitely plays a role. And then how you're fed as an infant. So formula feeding versus breastfeeding. Again, I think, and I say it all the time, like conventional medicine's here, sometimes alternative things are here, and I really try to be in the middle. But just from a feeding perspective, making sure the baby is fed, but definite benefit to breastfeeding for the microbiome. I would say that I have always been an anxious person. Again, I have a lot of family history. I don't like to say like my anxiety because I don't like to label myself with that, but I'm a worrier. I've been like that since I was little. I can remember laying in bed when I was like 6, trying to figure out what my plan would be if the house was on fire. And that's not normal. So I felt like that doing this gut testing would give me some answers as far as, am I eating the right things? What do things look like? And I want to be proactive and prevent chronic disease, whether that is, diabetes. I had done my DNA core and I'm at increased risk for diabetes. Even like autoimmune conditions. I see so many autoimmune conditions, especially in females. I think that it's a combination of like our culture and go, stress, definitely our foods, but it's just like, why does everyone have thyroid disease? Why is everyone gluten intolerant? Like, what is going on with all of these autoimmune conditions? And then the fact that I've worked in healthcare for a long time, so hyper sanitation, like working in very, sort of sterile environments, lots of hand sanitizer, and coming out of a pandemic where, it's hand sanitizer and Clorox and masks, and it affects the microbiome. And I do think besides, of course, we have like a social aspect and like, when we had to stay home and the effect that that's had on mental health, I also think that this is playing a role in a lot of conditions that we've seen post-pandemic as far as obesity, autoimmunity, and mental health. So that's why I did the test, and this is what I found. So here in the green, I mean, it lays it out pretty easily or clearly, I would say. So green, yellow, red. And a lot of times, from like a traditional medical standpoint, like we're looking to make sure nothing is in the red. And as long as you don't have a full-blown disease yet, it's like, okay, everything's fine. Come back and let's recheck it. But we want to catch things before it's actually a problem. And we don't want to get to the point where we have the problem. So when we're looking at expected beneficial flora, we want all of these numbers in front of these bacteria to be at least 3 or 4 plus. You can see here with mine, I have a 2 plus, a 1 plus bifidobacterium. You can look this up, fascinating. They are linking low bifidobacterium to long haul COVID and patients that had really severe forms of COVID had lower amounts of bifidobacterium. That's just fascinating to me. And they think that potentially ivermectin was increasing it, and that's why it did play a little bit of a role in, thinking that it helped a little bit. I still am not here to get into all that or endorse ivermectin at all. But it is fascinating. My E. coli was good. Lactobacillus was 2 plus. I had actually no growth. NG means no growth of the Enterococcus family, and 2 plus of Clostridium. So not a lot of good stuff growing. And a lot of the literature says once we get to the point of having no growth, we really have to re-inoculate that with a good probiotic, high potency probiotic. It's really hard to get that to start growing again just from like dietary sources. But I would say that like I eat pretty well. I eat probably more fruits and vegetables than the average American. I have tracked macros for years and have had good luck with that. I eat a lot of like cultured Greek yogurt. So I was surprised that these numbers were as low as they were. And what's interesting is, in the macro tracking, I don't like track every day now, but I did track a couple days before I started the elimination diet, and I was not really getting a ton of fiber. I thought that I was getting a lot of fiber and I really wasn't. So we'll talk about that as far as the plan. But the other thing is, all of this imbalanced flora, these are weeds. It's taking up space. It doesn't need to be there. I see all different types of bacteria. Interestingly, I see a lot of group B strep, especially in women who tested positive for group B strep before deliveries. That's something that they will test you for before you have a baby. So two different types of strep, just weeds that don't need to be there. So my goal is to clean this up so that there's more space for a thriving garden, or forest, and to increase the amount of these good bacteria. So I posted yesterday on social media, but just some of the obvious things that will affect this is, like I said, hypersanitation. I mean, one of the best things that you can do, especially like for your kids and from an early age, is let them play outside barefoot. We're so like overprotective almost, in the way that we're raising our children these days, but letting them go outside barefoot and play in the dirt. And I'm not saying to like let them eat handfuls of dirt, but if they have dirty hands and they touch their face, I mean, that's how we're building the microbiome. And even for us adults, getting out, doing some gardening, getting your hands in the dirt, standing barefoot, in the grass, in the earth, really goes a long way to help all of this grow. Antibiotics wipe this out. So there are many studies, even in, the conventional setting, about how one round of antibiotics affects your gut for even 2 years after you've taken it. I am not at all saying that antibiotics don't play a role or serve a purpose, but they are very overprescribed, and we don't always need, an antibiotic. Alcohol affects this, poor nutrition as far as like fried food, sugar, heavily processed, the standard American diet doesn't do anything to feed the good bacteria. All right, so moving down a little bit, the yeast culture. Yeast is really hard to culture out, but mine actually made it to the culture. It is still a friendly yeast. It's not over here in dysbiotic, but again, it's taking up space that I don't necessarily want it to be there. And from the patients that I have worked with, I notice a direct correlation between yeast that's growing in any amount and sugar cravings. So, if you're someone who feels like you crave sugar, if you have a little bit of sugar, you have no self-control, candida is definitely something that we want to look at. And the treatment for it, or what we would recommend if there is some yeast or yeast overgrowth, is a low carbohydrate diet, specifically low in processed carbs. So lots of fiber filled carbs like beans and lentils and fruit. But even limiting those things for a period of time can be helpful in getting rid of the yeast. Then we go through all the viruses and pathogenic bacteria, parasites. Thankfully, I did not have any of that pop up positive. Certainly, if you do, you typically have some decently significant symptoms. So if we look here under other markers, you can see the yeast popped up as moderate. Yeast likes to clump together and live in like little colonies. So sometimes it's hard to like see it actually on a culture, but like I said, mine was there. Sometimes I'll see the yeast culture be normal, but we do see it here like in the other markers. And then we look at red blood cells, white blood cells, and these muscle and vegetable fibers are a good indication of how well you chew your food. So if there are any vegetable or muscle fibers, a lot of times eating on the go, eating quickly, not chewing thoroughly, we'll see those pop up. So my numbers were still in the green, but I would like for the vegetable fibers to be none. So just, kind of being mindful of sitting down when I can to eat, which isn't always often, but even if I am having to stand, serve kids, eat in the car, that sort of thing, being mindful to chew, and just slow down the pace of the eating a little bit. We look at mucus. My mucus was negative, which is good. And then looking at digestion and absorption, this is an indication of pancreatic function and pancreatic enzymes that really help break down, digest, and absorb the food that you eat. Mine was good. Over 500 is what we like to see. As we age, the parietal cells in our stomach stop producing as much stomach acid, which then triggers the pancreas to release the pancreatic enzymes. So typically, if I see a patient be anything less than 500, we'll do a digestive enzyme supplement to help with that, or even a couple tablespoons of apple cider vinegar several times a day is really helpful for stomach acidity and pancreatic enzymes as well. Inflammation is all negative. This is what we would see if you had any sort of inflammatory bowel disease, so ulcerative colitis or Crohn's disease. Those would be markers that we would typically see with that. So the other big thing that popped up here on my test that I was, I guess not surprised by, but like, okay, yeah, I need to make sure I'm taking care of myself. Secretory IgA. So when we talk about the immune system and how at least 70%, more than 70% of our immune system's in our gut, our first line of defense against outside things is our skin. And the second is our intestinal barrier, and it's 1 cell thick. This is where we're looking at that secretory IgA. So things coming in, your body, your intestinal barrier is there to identify, is this autoimmune? Is this autoimmune? Is this cancer? Is this, and go through all the cells and decide what needs to be dealt with and what can make it through. So when we see this elevated number, this is a risk for autoimmune conditions. This is an upregulated immune response. So either I was getting over some illness at this point, which I feel like all the sicknesses around here run together. That could be it. But this is a big focus of my gut healing work because I don't want this to stay high. Just from what I know about autoimmunity in females and thyroid disorders and lupus and MS and all those things that I see so many women with these days, I don't want this to stay high. So really making sure that I'm taking care of myself, that I am not stressed all the time, that cortisol levels are reasonable. Like those are all things that are going to play into what I do about this. And then this section on short chain fatty acids, there's a lot of funny names here, but what you need to know about this is these are byproducts of dietary fiber fermentation. So basically, this just means that I need more fiber. And we know, the GI doctors have been saying for years that high fiber, that's what prevents colon cancer, colorectal cancer. And we're learning so much about other types of cancer and how important it is to get adequate fiber, even things like diabetes. So big focus to increase colorful fruits and vegetables, beans, raspberries have the most fiber of any fruit. Broccoli, I have a really good fiber guide that I've put together that I kind of like offer up on Instagram quite a bit. But if you want a copy of that, just let me know and I'll send it to you. But fiber. So I would say let me just finish this real quick. So no blood, everything else is fine. That's the end of this report. This goes through like every section and kind of goes through it. But I have mentioned several times that I'm doing what we call the 5R protocol, which is the gold standard in functional medicine for gut healing. So it's remove any inflammatory offending foods. So I started an elimination diet on Monday. That there are many different forms of an elimination diet. But the one that I have laid out in the program and that I am doing is basically no dairy, no gluten, and just basically like no really like processed food. So lots of fruits and vegetables, lean protein, still doing beans and all that kind of stuff, nuts, but really like if you've ever done Whole30, it'd be very similar, but we also take out eggs. Eggs are actually one of the most common triggering and like allergenic foods. So started an elimination diet on Monday. That's remove. We want to repair that intestinal barrier, which again is coming back to this number. So things like beef broth, beef broth, bone broth, collagen. That's what that barrier is made of. And so doing things like collagen, gelatin, and bone broth are really helpful for the intestinal barrier. The remove, repair, replace, we're replacing those digestive enzymes. So doing some apple cider vinegar with meals. The other thing here is herbs. Herbs are a great thing to incorporate in your cooking. Even just in salads, like a handful of parsley or basil. I have a couple pots out on our back porch that you can get just, little plants at Trader Joe's that are just the same cost wise as getting like a package of herbs, fresh herbs from the store. I feel like they sit in my refrigerator and they spoil, but plant a couple herbs in just like a small pot. You can keep it inside, you can keep it on the porch. And then bitter greens, so like arugula, kale, spinach. Greens are a really good addition as far as like replacing the digestive enzymes. So remove, repair, replace, reinoculate. That's reinoculating that good bacteria up here that we saw. So I'm taking a really high potency probiotic for probably the next 30 to 60 days to reinoculate and just really focusing on feeding this good bacteria. This good bacteria loves fiber, it loves fruit, it loves vegetables, anything fermented. I'm not doing dairy right now, but I'm doing like a cultured coconut milk yogurt, kimchi, kombucha, those sort of things. You have to be careful with kombucha though, because a lot of them have a lot of added sugar, but really focusing on feeding and reinoculating this good bacteria. And then the fifth R is rebalance. So rebalancing the nervous system. Again, the significance of the gut-brain connection. I also did, I haven't gotten the results yet, but a cortisol tracking. Cortisol plays a big role in the integrity of the gut, and stress plays a big role in the gut. That's why when you're nervous or anxious, your stomach can be a mess. So I did a cortisol pattern on myself, and I'll share that with you guys whenever I get it back. But just making sure that we are, not in fight or flight all the time. So I know I have a really bad habit of like racing to the gym and not cooling down and racing to get the kids. And it's like from the second that my feet hit the floor, it's like go, 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 go. And I never am coming out of that fight or flight sympathetic nervous system and getting into the parasympathetic, like rest and digest. So focusing on doing some lower impact exercise, not high intensity stuff, not cardio, but a couple days a week of weightlifting and just walking, getting steps in. Doing the breathwork app. I post a lot about this on Instagram, and I just got a notification about a webinar that some brilliant doctors are doing on the significance of breathing and well-being. So making sure that I've been turning on that app and doing a wind down, like cool down after I do any sort of activity, or even if I'm just feeling stressed, if I can like feel myself in that anxious, thinking of the to-do list, what do I have to get done when kind of state of mind, and then turning off my phone, leaving it in another room, and reading before bed. Not always being exposed to this blue light, all day long, and then expect that when I turn the lights off, my brain is just going to power off. So having a really intentional bedtime routine so that I'm getting quality sleep. I mean, all of this stuff goes together and it all really significantly affects the gut. So those are things that I have always known to do, and I tell other people and coach other, my clients on doing those things, but I'm not always good at doing them myself. But now that I see my testing, I'm like, okay, got to make this a priority. And then I probably will retest this, do another CSAP in 3 to 4 months, just to see what progress I've made, make sure that I'm on the right track. So let me just back up one more second to elimination diet. We recommend doing an elimination diet for 4 to 6 weeks. I'm going to set my goal at 4 first, and if I can go a couple weeks longer, great. But I still have a really busy life. I mean, my son has a travel baseball tournament this weekend. The kids are in school. I spend a lot of time in the car. Like, life is crazy. So I always tell people, if I can do it, sorry, if I can do it, you can do it. But really just kind of looking at it as a set period of time. And again, there are so many different forms of an elimination diet. I have a specific one laid out in my program with a cookbook and lots of resources and things like that. But an elimination diet really can be, so many different versions. So like I said, I'm doing no gluten, no dairy, no eggs, and really, just whole foods. When I do food sensitivity on clients, though, I will specifically have them take out foods that that I know that they're sensitive to based on their food sensitivity. So we kind of work through that. But that is the gist of my report and what I am doing about it. So supplement wise, I'm taking a really high potency probiotic, like I said, for 30 to 60 days. I'm definitely eating less carbs because I'm eating, like not processed food. Like most of my carbs are probably coming from fruits and vegetables and beans right now. So as far as the yeast, that should definitely help with that. But I also just started a supplement. It's called Saccharomyces boulardii, and it's a friendly yeast that can help crowd out and get rid of this other yeast. So I'll take that for a couple months to hopefully crowd out some of this other yeast. And then if you starve yeast of its food source, which is sugar, simple carbohydrates, it will die off. If you don't feed something, it dies. And then I'm taking all my usual like B complex things that I had already found on DNA Core that I needed more of: B complex, antioxidants, that sort of thing. So supplement wise, that's what I'm doing right now. Hi, Sarah. Good to see you. I was just wrapping up, but I'll make sure that everyone on the email list will get a copy of the recording. Does anyone have any questions right off the bat? If you do, you can speak up or you can type them in the chat. Let me just make sure I can see the chat. All right, seems like y'all are good. Okay, well, when you rewatch, if you have any of you who are going to be watching the replay, which I know it's most of you who signed up to get the replay, if you have any questions, you can reach out to me on Instagram. I check my messages often. You can also email me at hello@emmyheartsnutrition.com. I think that's right. Yes, so either place, I will answer. If you want to set up a consult to talk about about my program, any of the different tiers. So I have 3 different tiers, from nutrition consulting all the way to the full functional medicine program. We work together. I work one-on-one with each patient over a period of time. I don't see consult to consult. I just get so much more joy out of going through life with people, and I have found that the outcomes are better because there's so much of life as far as like eating out and travel and stuff like that, that it's helpful to work through. But if you want to set up a consult for anything like that, or just have any general questions, please let me know. Thank you all for popping on live, and I'm excited for you to be able to watch the replay.
Thank you.
Thanks, Kathy.
Yeah, thanks.
Thanks, Sarah. Bye,
It's
Frida.
good to see you.
I'll talk
Been
with you
too long.
soon. Frida's already one of my wonderful patients.
Love it. Have